Good afternoon, friends. David Wright here, and I am your host of the Disruptive Innovators Champions of Digital Business podcast. And today I am lucky enough to be joined by my friend Ryan Olsen. Ryan, it's a pleasure to have you on.
Pleasure to be here. Thanks for having me, David. Good to see you.
You too, man. You too. Happy New Year. Ryan, for those of our listeners who may not be familiar, do you mind just sharing a minute about your current role?
Yeah, thank you. I'm the Chief Administrative Officer for Hoag Health System here in Orange County, and we're 11 plus billion-dollar system, two hospitals, integrated medical group, ambulatory surgery centers. And in my role, I'm working with the hospital service lines as well as the ambulatory footprint. And, just have loved every minute of being at Hoag. It's an incredible culture. Our CEO talks about the family that we are, and we treat family and neighbors here, which I think is a big distinction between, other systems talking about patients. And I do think it shifted the culture positively. So I've just been so fortunate to be at Hoag. We've got an incredibly supportive community. And so to me, it's just been one of the best systems I've ever worked for. And I'm so happy to be here.
Yeah, I mean, that was one of the things that struck me, when we first connected, really, was the culture that I witnessed when I saw you post about Hogue, or what the things that I saw you guys doing, or all of that was, I was very impressed by that. So I am excited to get more into the work that you guys are doing at Hogue, and talk a little bit more about that. I actually took an interest too in kind of your role, if you will. Joe Muscola, he was at Northwell Health for a long time. He wasn't a CAO, but he was like kind of EVP system operations, oversaw a lot of things similar to you, and we just had a real. I learned a lot from that dialogue. Anyway, so excited for that. Before anything though, we always do like to ask if there was only one, because I'm sure there will be many, but if there were only one piece of actionable advice you might look to leave everyone with today, what might that be?
Build trust, through relationships. I can't, it's so simple, but understated, especially with physicians, right? And healthcare, that if you lose that trust, you cannot accomplish, in my mind, anything effectively or swiftly. So to me, it's that actionable item is building the trust, sustaining the trust. And that means being authentic, present, all the things we've learned through the years. But how many times I've seen it lost because people overcommit, undercommit, can't seem to maintain that level of trust or transparency. It really hampers an organization's ability to succeed. So it's simple, but build and sustain that trust.
Yeah. No, I mean it's great. It's great advice, and it's interesting because you hear a lot of people talk about, because a portion of our audience, I would say, are in the technology sales community. In one way, shape, or form, and you hear a lot of people talk about like relationship selling. But you mentioned something as you were kind of talking about I think you mentioned authenticity, or I mean, but the for me, human connection and relationships aren't about selling something, right? It's about like me making the person feel understood, and me being of service to that person. And it very well in that moment may not be in selling my wares, right? It might be introducing their son to a new internship program. It might be recommending a restaurant. It might be like, it could be any number of things, but let me not go into that conversation with a preconceived notion of something I'm trying to sell them. You know what I mean? And I think for me, that's been one of the keys to building relationships.
Yeah, I think, right, it's, you have to, at a base level, not think about transactional issues, right?
Right.
You have to think about getting to know the person, and it doesn't matter whether it's in sales, negotiation, leadership, operations, whatever. I think if, to your point, if you really go in at base level trying to understand that individual, it just creates so many opportunities. I'll never forget, a class I had in graduate school on negotiations that, if you listen more than you talk, you're going to do that much better. And I think it's the same in relationships, right? I just have been so fortunate to have these different relationships that I think have carried results. So I think to your point, if you go in trying to understand, building it, thinking about connections, like you said, whether it's an internship or, how you can connect at any level, that will drive organizational results.
Absolutely. Um, I mean, great things to think about starting off the episode. So Ryan, like I said, I'm excited to talk about Hoag. To start though, and we've had some conversations offline. I'd love to talk a little bit about your journey as an executive. So basically, as far back as you'd like to go, kind of how you started out and how you got to the point that you're at in your career today.
Well, it's been a journey. And as I've told a class recently at UCLA, I've had my successes, I've had my failures, I've learned a lot from those failures. I had opportunities early on to work in places that needed help and give me opportunities that I wouldn't have had elsewhere. So I did a fellowship at the VA. I worked at Cedar Sinai up in LA. And then I had a boss early in my career who gave me the ability to lead physicians and staff. And I'll always be grateful for him. He was a chair of radiology who had a business sense that was incredibly adept. He really would quote Upton Sinclair all the time, who said that you can't teach someone to understand that which they're paid not to understand. And that is, in terms of aligned incentives, he taught me more than anyone. And having to boot these clinical departments in terms of their productivity model and have tough conversations with physicians and say, look, you're going to lose 50,000 a year on this at risk model. You can make more, but you're going to have to earn it, sort of thing. And that was just kind of a landmark thing for me. And then my first executive job was with great leaders up at St. Jude Medical Center in Fullerton. They gave me the opportunity to be a VP of ops. And that was a culture that's a little bit like Hoag, that we'll talk more about later, but mission driven and dynamic and wanting to grow in that community. So they gave me kind of wings to fly, creating academic partnerships and growing programs and really learning the hospital side of the business. And then I had a great opportunity to go back to Cedar Sinai and work with some of the best surgeons in their field on the medical group side. And that was with the leader, Tom Gordon, that was another great mentor that exuded love for all that he led and who he led. He really supported and loved the people that worked with him. And he was a great mentor. And I got to know the surgery center landscape. And so I ended up doing the medical group and hospital about half and half in my career. And it's been great. I've really enjoyed both aspects of it. And then, I've worked at Providence and I've worked at Palomar Health down in San Diego. And I was the CEO of the medical group and COO of the system, and then had the opportunity to come here to Hoag. So I think it's been hallmarked by strong physician partnerships and the ability to see positive change in each of these roles, whether it's through growth or operational success. And it's all come through teamwork. And I love teams. I love creating high performing teams. And I couldn't do it in my career without them and great mentors. So I've been really blessed in my career.
Yeah. No, I mean it's amazing that you'd acknowledge those leaders who had an impact, and I can think back to a number that have impacted me, and Cedar Sinai, amazing culture. I agree with that too. What would you say, Ryan, is one of the most important things that you learned over the course of that journey?
You know, I think just being placed in these different, somewhat precarious turnarounds, like, I don't know that I've ever been in a job, and most executives aren't, where it's just, going incredibly well, right? There's nothing to improve, but some ways I've been put in, like, extreme turnaround situations, uh, and, uh, and even in high performing organizations, there might be an element that needs to be completely, redone, and so, anyway, I think I love the book, Good to Great. Everybody kind of goes back to it again and again, but that, Stockdale Paradox from Admiral Stockdale, right? That on one hand, you have to have the unwavering faith that you'll make it through while simultaneously facing the brutal facts of your situation. Well, I don't know how many times I've had to use that, in my career, like that. Hey, team, let's face the brutal facts here. Like, we've got to completely redo the way we're doing business today. We've got to completely reboot how we're, recruiting, who we have in the department or in the job, and it's going to be a lot of sacrifice, but we'll make it through if we do it together. And so I keep coming back to that because it's carried through so many turnarounds, and I think it's led to success. So that's probably one thing I keep going back to.
Yeah, no, it's fun. I'm smiling because I was out with the CEO of an organization called Hummingbird Health, my friend Jeremy last night, and obviously fellow entrepreneur. We were talking about like three of the main characteristics a successful entrepreneur needs to have in, you know, understanding, but not being like consumed by or, dwelling in the past, having that very pragmatic view of like what's in front of you, like what kind of the what's working, what's not working, and then also that unwavering vision of like what's to come. It's an interesting, tricky dynamic, or it can be, but I think the kind of like you're alluding to it's a leadership characteristic, not unique to entrepreneurship, but just like you said in your role, if you're going to be traversing difficult situations, right? Be it a turnaround situation or just like in any business in any leadership role, you're going to have to overcome difficult situations. I think that's a good mantra that you can lead with. And I also, I mean, what you were saying before about like misaligned incentive earlier and like needing to re enroll people into a new possibility, like going into work in the UK, like it's like it's a lot. It's a lot. And but I love that you're you know y- those conversations can be difficult conversations. But I think if I've gotten used to having difficult conversations, and now they're not so difficult anymore. They're not as scary as they once were because it's just about facing the facts, I guess, you know?
Yeah. Yeah, I think that's exactly right, and done compassionately, but directly. People don't
Right.
want you to beat around the bush when you're having a tough conversation, and that's what that boss taught me to do early on by giving me the rein taking the reins off to be able to have conversations of, "You're no longer gonna work at this organization. I'm so sorry, but that's the way it is." And, um, some of those that we let go, are still friends today, which I think was just kind of a miracle of, like, their understanding of the ultimate vision and where they were placed in that vision. But yeah, I think difficult conversations are what makes change possible. So I think it's a really good point.
Right. Mm. Yeah, and in not having that difficult conversation, I may be hindering someone of a new opportunity to do something that I didn't even, realize, or I don't know. I just feel like there is a plan the universe has. That's my humble opinion, but neither here nor there. Another question. I mean, you mentioned like some of these turnaround situations. You mentioned when you were speaking to the class, like difficulties or failures, over the course of that time. Is there a moment for a project, personally, professionally, otherwise, but like a moment where you had something fail or something like that, but you ultimately took away a lesson that you still carry with you today? Like, is there one or two you might be able to share?
Yeah, I think I mean, I've had a lot, so we'll try to keep it brief, but I think I think the underlying politics in organizations were something that, as a young executive, I didn't understand, and that's, it's one of the most unfortunate parts of any organization in my mind, especially a healthcare organization where, you're there to serve the nursing staff, the doctors, the patients to make it better for them, and it's the unfortunate reality of turf and politics and understanding where to step and what to say. And I think early in my career, I had a situation where a lot of the staff and doctors felt like I should be the key executive. And, without going into too much details, like that was not smiled upon at the highest levels because it was impinging on someone else's turf. So, the way I acted and the way I handled myself, I kind of got caught up in believing them, right? That, hey, like, oh, I should be in charge. I'm the key executive on the ground here. I can do this job, and um, it probably got to my head, right? And if you're not using another principle from Good to Great, right, which is like being ever learning, that's more of an Adam Grant thing, but being ever learning, self-aware, humble,
Humble.
yeah, you'll step in it, and I did. And I was basically pushed out of that organization, and that it was a great learning. Like I've always remembered that, and I've never fortunately had it happen again. It's not that we don't have politics wherever we go, but I think that that really taught me a lot. And so yeah, I've had other learnings of preparedness and trust and making sure that you trust but verify. Um, and just all that I've learned along the way. But that was probably the key learning of that humility and self-awareness that I've always retained.
Yeah, you know, I've said it before, just because as it happens, the vast, if not all, the leaders that I've had the privilege of hosting on the podcast have been very successful leaders and humble leaders, right? Servant leaders, leaders that arrived at that place through one way or another. Because I think to get to a leadership position like you're in, right, or to strive to become an entrepreneur or to whatever it might be, it takes a certain level of drive and stick to itness and confidence, right? That for me in my younger years uh, was largely driven by ego. And like I say that like overinflated ego, just because there was a level of that swagger that was needed, but really at the time for me it was also a tool for me to hide feelings of insecurity, or fear, really, that I still didn't know how to properly deal with, per se, right? I was still learning, I was still working that muscle, and so I would flex, and, I had my moments too that I had to, get checked, and, um but I'm grateful for those lessons, and luckily, I didn't have to continually fall on my face to learn it. I learned it, and I think, like with anything, emotional intelligence in the workplace and, leadership skills, and you have to continually cultivate that ethos. Like with whatever it is that you do to remain grounded and all that. I think for each individual it can be different, but it's not like I've arrived and now I'm, you know, enlightened. It's a daily practice that I get to, like you mentioned right at the onset, like I can continue to learn each day in every conversation and every interaction, just look to get a little bit better effectively.
Yeah. But no, I think that it is a constant battle, right? Of not having an overinflated ego in leadership, and the fact that people will treat you differently and you take it for granted, and what they say to you and how they interact, you forget you have that honor of responsibility sometimes. And so yeah, it's a constant, like, keeping yourself humble. Whether it's a spiritual practice, a physical practice in terms of working out, or humbling yourself in that way, right? You've gotta be self-aware and stay humble, because otherwise you'll not be as effective of a leader.
That's been my experience as well. And the politics just in general are very tricky, particularly within health systems. Particularly if someone's bonused a certain way, or there's all sorts of tricky things to navigate. You know, academic versus not academic, state by state, federal things that are happening right now. I mean, it's a lot. So, you know, I think these practices are very, very important to staying calm, staying level headed, and navigating things like that. I do want to, Ryan, get into a little bit more about Hoag. I do at this juncture like to ask about your favorite book or literary piece that you read recently or all time. You have mentioned a couple books already, right? So you mentioned From Good to Great. What was the other one you mentioned?
Well, Adam Grant has a couple books.
Right.
I really enjoy him as an author. I really love the historian David McCullough, and bringing some of these heroes to life, right, in terms of his biographies. 1776 Truman. Truman was an incredible man of humility and real vision, right? And sometimes seen as aggressive, but what he did for the country was remarkable. The Wright brothers as innovators, he just did so many interesting profiles of people he really admired, which I thought that's why he was a great historian. Um, but no, I think that for me, yeah, I boringly enjoy kind of business leadership and historical books. The Hardest Job in the World by John Dickinson. That's a great book, and really talks about the paradigm that each president used, and kind of that war room experience that they had, and how they kind of led their teams. And then, watching and reading about professional coaching, Phil Jackson, John Wooden, et cetera. Just really enjoying learning from them.
Yeah. No, I mean, and it's amazing when you read these books about people who lead at those levels, or athletes or coaches who operate at those levels, and the dedication to the craft and the little things that they do to that amount to that greatness that you just have, or that formerly I've read it, some similar different books that just had no idea what goes into it, but it makes sense. It makes sense, and you're not the first executive to mention some of these, like, historical biographies of leaders like that. So I think it's a sign that I have to dig into a couple of those, so I might have to do that.
Have you seen 1929? It's Adam Sorkin. It's on the market, how the market's changing, and how it ultimately collapses. But that reads more like a novel. I'm only halfway through it, but it's a really interesting read so far.
Maybe I'll start there. Very good. Um, So Ryan, so how long have you been at Hoag now? It's
It's been a year and a quarter about.
been a year and a quarter. So you're operating as CAO. Talk to me a little bit about your vision for the organization, based on the overarching mission of Hoag, and maybe some of the key initiatives that you're working on that you can, share with us.
Yeah, I mean, I'll just give you kind of the way our CEO Robert says it, which is we've gone contrary to the national trend of consolidation, and
Mm,
we've been hyper focused on Orange County. And I think that's an interesting concept, right? That Hoag is interested in the absolute excellence of delivery to every family and neighbor that we take care of, right? And so Hoag is very focused on quality, financial performance, and balances the majority of its weight of incentives on quality and then KPIs for the organization, or OKRs. So these are the specific goals around everything from integrating ambulatory surgery centers to getting a certification for an age-friendly hospital to having a heart failure program, et cetera. So these are about 60% of the organizational goal set between quality goals based on mortality, process improvement, and then the OKRs or KPIs, in other words, of performance. Then you have overall financial performance of the organization from an EBITDA perspective. So Hoag does it better than anybody I've seen, setting the goals, cascading the goals, having accountability for the goals. And that is really feeding the organizational drive to open a new hospital, to grow in the south part of the county of Orange County, and to continue to deliver the highest quality of care in a private model. Similar to what Cedars-Sinai's done up in Los Angeles to be that for Orange County, developing the tertiary and quaternary nature of our programs, using these goals to become even better than we are today, so that we're chosen again and again by Orange County. So I resonate with that goal. I mean, I really have been impressed with what I've seen, right? I'm just a disciplined organization, maybe the most I've seen in terms of that ability to build a goal and go after it and achieve it. We did fortunately incredibly well the last year on all those elements of performance. And it was just amazing to see the teamwork and the leadership behind it. This year it's the same kind of drive, and it is feeding the overall growth, opening a new hospital, as well as just being that private center for Orange County. So yeah, it's been an amazing part of seeing Hoag grow. I do from my responsibilities. The big thing that I had to work on was integrating our surgery center platform closer to the Hoag system and working with physicians to set up a physician owned management company to guide our efforts in that process. And it was a great experience, working with these amazing physicians who've created the most successful surgery center platform with Hoag in Orange County. But it was a lot of work. I mean, it was weekly meetings with these physicians to have them take over the management. There was a previous management company, and the physicians were ready to take on the management and then work with a couple of partners to kind of create that ecosystem for Hoag. So that was kind of one of my big responsibilities and will be this year. And then we had an amazing cardiovascular program, and we had to essentially, redo the entire program or rebuild on what we had because we had several physicians leave and had to recruit 4 new cardiac surgeons. And we were able to recruit an amazing team of surgeons from all over the country who have a diverse and complementary skill set. And so these surgeons are helping us create our LVAD program. We hope one day a transplant program, and helping us become very tertiary quaternary in the cardiac service line. So those are some of the things I've been working on, developing a cardiogenic shock program. That was probably one of the favorite things I've seen in my career because of the collaboration. between the intensivists, the ED, the cardiologists, cardiac surgeons, to create a program that's in this, top 25th percentile in terms of all the different metrics, and really implementing the National Cardiogenic Shock Guidelines. So just, great to be part of that and just see Hope continue to evolve as a health system.
It's great to know that you guys are so tied to these, I mean, admirable outcomes that I think translate to, you know, having an impact on the business and your financials and the stability of things, but also having impact on the patient and the physicians and nursing staff that you're serving and the administrators. I mean, it seems like and from what I can understand from the outside, and then what you're sharing now, it's just um, overall the mission and not just what you guys are saying, but the actual things that you guys are benchmarking and working towards are impactful.
Yeah, it's meant to serve the community in a higher and better way, right? And I think that's where people get excited, and you see the teamwork from across the organization. I know that I've seen some very supportive communities, but there's none more supportive than Irvine, Newport Beach, the surrounding areas of Orange County, who provide so much support philanthropically to that enable us to create these high performing programs. For example, in our cardiac program, we've got 6 or 7 nurse practitioners funded by philanthropy. And, it allows us to deliver just the highest level of care because of this support. So it's anyway, you just can't understate how big of a deal that is for Hope.
So Ryan, what about some of the biggest difficulties you guys are facing as an organization to that?
Yeah, I think because of ACA subsidies being reduced, the Medicaid cuts, we're going to have to take care of more of our neighbors and family that are underinsured, uninsured in Orange County. That's going to have an impact on the bottom line. So we have to be more efficient in other areas. Everybody is dealing with that issue across Orange County and across the country. And for Hoag, because we are hyper focused on Orange County, we are a little bit smaller, right? We have to be even more efficient in things like supply chain and operational process. So that's how we need to offset some of our size constraints and some of the national policy changes that are impacting us. Um, but yeah, we just feel because of the community and because of the team we have, we can overcome that. But they are going to be daunting challenges for us in 26 and beyond.
Sure. Well, that makes sense. I mean, and it seems that, you know, again, with the culture and the community that you guys have surrounding you, um, you'll be in great shape, particularly comparatively to some of the other, spots in the U.S. Not to compare, but Ryan, what about got a couple more questions for you. Where do you see the future of healthcare going, um, and or what do you think will be some of the biggest changes as time passes, technologically or otherwise, but just, noting you don't have a crystal ball in front of you, just maybe some pontification on some of the things that you think we'll see here moving forward.
I, of course, do see AI playing a supportive and somewhat disruptive role, right? Can it help physicians? Can it help advanced practitioners, right? Can it help our staff do their job more effectively? And things like ambient AI for physicians, inbox work that AI can do to support clinicians. I think that's going to be supportive and just positively disruptive as we continue to adopt it, as everyone knows. But will AI replace any physicians? I tend to believe it won't. You've seen Elon Musk talk about the replacement of surgeons within 3 years. I've been fortunate to see the excellence of our surgeons. I think AI can help with certain algorithms and protocols. Can it do what a heart surgeon does? Can it do what a neurosurgeon does? I really doubt it, right? And so I think the disruption there is going to be um, supportive, not replacing. Um, and so I think certainly I see that having a big impact over the next 5 years. I do think that national constraints from a funding perspective will have systems make hard choices for us because, as you pointed out, our geography and everything, we're going to have to become that much more efficient. But for choices for district hospitals, like the one where I used to work across California, or those who don't have a lot of philanthropy, I mean, it is brutal choices of consolidation or closure. And I think, we're going to see more of that, right? And I do think that, there's as there are changes in physician education and the ability to recruit primary care doctors and building primary care networks, the systems that can do that effectively and support their primary care doctors will see the biggest return on growth and population health management. And systems that can't afford that will just be hampered, and it will lead to more closure and consolidation. So, um, yeah, I think that's the next 5 years. I do think that coming out of COVID, um, we're in a much better place. We still have our challenges, but the hyperinflation that we saw, it's still an issue, but we have a bright future. I think it's for the first time, I think we can say that, we have hope ahead for our health systems. And I'm very excited about that.
Ryan, this has been amazing. I've gotten so much out of today's conversation, and I really appreciate you taking the time. Last question I have for you would be, if you could go back 5, 10, 15 years in time, what advice would you give your younger self?
You know, I would tell myself to prioritize mental and physical health first. Uh, the I when I was young, I think I became a workaholic. I won't go in like my upbringing and everything that drove me, right, just to be hard driving, career oriented. And I had to learn through some pretty hard lessons, like even being depressed, right? Of just having to take that time. If you take care of yourself, you'll be a better leader. And so I would tell that younger self to make sure and do that, because if I had done that earlier, I probably could have avoided or been that much more effective, right, for a year or whatever. So I that to me that's a big learning. And then just don't take for granted the relationships and keep every relationship you have. Um, because as much as I've tried to do that, I haven't done as well as I wanted to. And it's amazing how every job I've ever gotten, every good thing I've happened has become of the relationships I have. So, even a greater emphasis on that.
Yeah, that's sage-like. I mean, great bookend to the episode, and I couldn't agree more with the physical and mental for me, emotional and spiritual as well. I mean, that when I, had those experiences and arrived there where I was willing to do the work, my productivity and effectiveness as a leader was impacted exponentially. And like the success that I experienced after that, that wasn't the reason I did it. In fact, I did it because I got extremely uncomfortable. And that's why I was willing to finally do some of the work. But once I got into it, as a byproduct, my productivity skyrocketed. So I'm, again, huge proponent of that as well. But no, Ryan, this has been amazing. Thank you so much for taking the time today.
Thank you, David. It's good to see you. Thanks for giving me the honor of being here.
Oh, no, the honor's mine, my friend. And to our listeners, thank you all for tuning in, and we will catch you all next week.